Hello. Today is a sad day. We mourn the loss of Matthew Perry, a actor behind Chandler, my favorite character in Friends, and the main character in Whole Nine Yards, my other favorite movie. We're all gonna miss him dearly. And I thought that maybe this is the very good day to start our series on addictions. Matthew released his book on his lifelong fight with addictions, and he looked forward to the rest of his life, but it was not very long. So let's talk about Matthew and addictions, and maybe use some of his quotes to sort of just establish a framework around addictions. There are going to be more videos to come. Please subscribe to my channel if you want to learn more about addictions, mental health, psychiatric treatments, etc. My name is Dr. Ruben Gagarin. I'm your favorite family psychiatrist. Well, let's dive in. In the book, Matthew implicitly refers to biopsychosocial model. He's talking about biological predisposition, psychological factors that affected his life, social support. So let's use that model. I personally and professionally subscribe to this model, so it is kind of easy for me. From biological point of view, we're born as different people. We have different so-called temperament. Temperament is different from temper, although I'm sure they are related linguistically. So temperament refers to the character of a person that we are born with. So Matthew describes himself as a colicky baby. What does that mean? Well, if you think about babies, when they're just coming home from the hospital, they have different character, don't they? So some of them, they can sleep through the night on the second week. I heard about that. So sometimes they cannot sleep through the night until the second year. So he's talking about himself being more emotional, maybe a little bit more needy, maybe needing more support. And at the same time, he's talking about his parents as being unable or unprepared to provide him with that support. So when he was only 2 months old, he was brought to the doctor because parents were not be able to handle him. So as a result of that visit, he was prescribed phenobarbital, which is, you don't use it now, it's quite a strong sedative. Of course, it helped Matthew to settle through the night, and it helps his parents not to be overwhelmed and continue their support to their baby. But that was the first time when Matthew was exposed to this sort of concept of using some sort of drug to calm himself down. Of course, at the age of 2 months, he was not aware that it was the drug. So why this is important? Well, it is important because at that age, according to developmental stages of development, kids supposed to be able to learn how to establish so-called equilibrium between themselves and the environment. How does that happen? Normally, the kids, babies, they get support from their mothers. The mothers are supposed to be mindful. They see when the kid is just being kind of a little bit bored, maybe wanted to play. In this case, it's a good idea to maybe leave them alone and learn how to regulate themselves. Or when they really need their mothers, the moms or dads in this context can jump in and save them from the suffering. From the point of view of Erik Erikson, Matthew was going through the first stage, trust versus mistrust. So besides learning equilibrium, he also was supposed to learn how he can trust his parents and by extension the rest of the world. It seems as if at that point the parents couldn't trust themselves, so they went to the doctors, they didn't know what to do, they didn't get the right advice, or maybe were not committed to that advice. We don't know, but the result was that Matthew did not learn how to establish his equilibrium with the environment, how to be comfortable by himself without any external intervention. So then another important point from biological point of view, Matthew is talking about biological predisposition. He is talking about his father seemingly addicted to alcohol, maybe other family members that suffer through alcohol and drug addiction. So what does that mean? Why do we have these genes that predispose us to alcohol addiction? It is very interesting that the same genes that predispose us to addictions also makes us very strong, driven to a certain goal, because we become goal directed, we become goal dependent, and we get strong reward when we get what we want. The problem with the drugs, it almost hijacks the system in our brain that's responsible for that reward. Later in life, almost called him Chandler. So Matthew worked really hard to become a successful actor, to achieve what he wanted to achieve, which was fame. And he was famous and rich, and how he describes himself, powerful. So we can see that he has this drive towards success and towards the reward for his hard work. And interestingly, from biological point of view, it's the same pathway in the brain that's responsible for that drive also drives people towards the drugs. Because when they drink or when they use drugs, that pathway gets reinforced. That's the biological predisposition. I'm referring to my notes. I have some quotes from Matthew. So he said that my grandfather, the wonderful Alton Perry, grown up around alcoholic father, and as a result he has never touched a drink in his life, all 96 long wonderful years of it. I am not my grandfather. There are two things to cover here. One, related to this point that I'm talking about, is that he has a long history of family history of substance abuse, so it made him predisposed. And of course another one is exposure. We're going to talk about that in a second, so stick around. In his book, Matthew talks about childhood trauma. He was traumatized by his parental separation. It seems as if his father left the family when Matthew was 9 months old. Mother was very busy at work, so essentially Matthew was abandoned. So, and he experienced that emotional abandonment very deeply, and it became very traumatic to him. We're going to talk about trauma in a different video, but generally speaking, there are two parts of trauma. One is the actual event, another one is the response of a person to that particular trauma. So we already know that Matthew was born as a very emotionally sensitive kid, as so-called colicky. So of course he would be more attuned to people's reactions and how they treat him. So when his father left, his mother was at work. She was too busy being press secretary to Prime Minister of Canada. So he felt that abandonment very deeply. And then his mother had a second child, so he felt even more abandoned and lonely. So that affected him a great deal. A lot of people who suffer from addiction do have history of trauma, more or less severe, but deeply inside, they all experiences very traumatic. Matthew talks about lack of social support. One part I already mentioned, the parental abandonment, and then he goes to school where he is being bullied, in part because he was overweight and because he was emotionally vulnerable, so bullies picked him as a target. So his parents were busy to advocate for him. He couldn't advocate for himself because he was too young. So as a result, he bullied without any support or protection that stopped him from establishing a social support at school, having friends, etc. So moving on, he started developing anxiety and depression. Of course, it started at a younger age. So in my practice, we see a lot of kids whose symptoms of anxiety and depressive disorder start around the age of 12. So, and Matthew's anxiety and depression probably started then. Why did he become depressed or anxious? Well, there are various reasons. Again, biological predisposition, but on the other hand, he entered a new stage in development. So by the age of 8 to 12-ish, people go through so-called fourth stage. I already mentioned trust versus mistrust. And fourth stage is industry versus inferiority, according to Erickson. What does that mean? At that age, it's really, really, really important for the child to develop confidence when there is at least one area when they are successful. But, of course, Matthew does not have that social support at school. He does not have social support at home. His parents are too busy or too absent emotionally or physically to be able to provide that sense of security and also sense of success. So he doesn't get it. As a result, he develops anxiety and depression. That I have a quote here from his adult self. I was making $750,000 an episode on Friends, but I was miserable. I felt like I had to be funny all the time. Even when I didn't feel like it, I had anxiety attacks before every taping. I was afraid of letting people down, of not being good enough. That is interesting. So there are a few things that to unpack here. So one of them is that he felt that he had to be funny every time to be accepted. Well, I guess maybe little Matthew, when he was around 8, 9, 12 years old, maybe at that time he found his humor, and he used the humor to deal with his emotional distress. Generally speaking, humor considered to be a healthy defense mechanism, but humor alone isn't enough. Humor alone cannot replace the family and social support. And then you can see that it became almost like his mask, that he covered his emotions, he didn't express himself, and the pattern of lacking social support continued because it became sort of self-fulfilling prophecy. He doesn't help himself, and he doesn't let other people know how he feels. He doesn't get genuine support from others. So far we covered quite a bit. We covered the biological predisposition, temperament, and family history, and we covered developmental stages that Matthew had very difficult time succeeding at, which is self-regulation and finding his confidence. So what happens next? Well, little Matthew turns about 13, 14, and at the age of 14, he drinks for the first time. He describes it as drinking at home with his peers, kids his age. So they had a lot of beer and wine, and at that point, he said that he felt the happiest ever. So he had never felt that happy. He felt as if the whole world kind of opened up to him, as if this drink almost opened his mind. And now, for the first time in many, many years, he felt happy. See, what is very interesting here is that if he had never been exposed to alcohol or other drugs for that matter, he would never develop drug addiction. Duh, that's pretty obvious. But how do we do that? It's very difficult because the drugs are everywhere, and at various stages of human development, we try to ban the drugs, we try to promote them, allow them, not disallow them, penalize them, penalize the sale of the drugs and use the drugs. Nothing worked. So I guess the only thing we can do realistically is educate our kids, promote sobriety, and for them to understand the dangers of the exposure. Some people say, when I was growing up, they would say that I should get exposed to alcohol because everybody drinks, and I should know my limits so I don't embarrass myself. So some of my friends, they started drinking at home with their parents. Now, I don't subscribe to that idea. I think that exposure is very important, and if I'm the one who exposing my kids to the drugs and alcohol, then it makes it very difficult for me to then support them if it happens so they develop drug problem. So we have to educate, and educate. That's all we really can do at this point. And so another quote from Matthew regarding 1997, that is when he became addicted to opiates. So he said that I was in a jet ski accident in 1997 while filming Fool's Rush with Selma Hayek. I broke my nose and my jaw, and I had to have a surgery. They gave me Vicodin for pain, and I liked it a lot. So he ended up taking dozens of pills every day to get himself high. Of course, he didn't have a pain anymore, but he continued to use this drug to get high. So exposure or lack of exposure is very important to protect our kids from substance use problems in the future. Now, what happened to Matthew once he started using on a regular basis? Well, when he was only 24-year-old, he was living with his father in Los Angeles. Father was drinking, Matthew was drinking, so he would drink to blackout. He missed half of his auditions despite his dream of becoming famous. So his health started deteriorating. So at some point he had pancreatitis, he had many visits to the doctors, and he had a ruptured colon that required surgeries. He ended up in an intensive care unit on ventilator, and only miracle kind of saved his life at that point. So with other people, you can see weight loss. So Matthew said that if I'm losing weight, I'm on pills. If I'm gaining weight, I'm drinking alcohol. So this ups and downs with weight, ups and downs with mood, ups and downs with sleep, that what you can see with people who start abusing or becoming dependent on the drugs. So it's very detrimental, and of course Matthew saw that. He's an intelligent person, so he tried to address his addictions, but then of course he relapsed multiple times. Another quote that illustrates the cognitive impairment because of the drugs, it made me cry, to be honest. So he said, I don't remember 3 years of Friends. I have no recollection of seasons 3 to 6. I was so high that I blacked out most of it. It's a shame because those were some of the best episodes. See, and that comes from a person who is very proud of his work at Friends. In another part of his book, he's talking about Friends, a show saving his life that gave him meaning to keep going. So it was indeed a shame that he didn't remember 3 years of it. Let's move on to recovery. So what happened to Matthew Perry? In his book, he's talking about going to rehab 15 times. 15 times. He said that he spent $9 million on his recovery, and he relapsed pretty much every time. Why? Well, he is talking about lack of social support and a culture of enabling. What is enabling? That is actually quite complicated. Of course, when you talk about Matthew Perry, it's pretty clear that he says that the whole environment was enabling. It was easy to get the drugs. He was surrounded by people who would just say yes. So he says here, I had a lot of yes men in my life, people who would agree with everything I said, laugh at everything I joked, complimented everything I did, people who would never challenge me, comfort me, or confront me, or criticize me, people who would never tell me the truth about myself or about the consequences of my actions. Well, from that statement, you can see clearly what enabling culture is. It becomes way more intricate when you talk about family. So you see the parents, and the parents are trying to stop their kids from using the drugs. And they're trying to maybe limit the harm that the drugs do to them. So what they may say, well, it's okay if you smoke weed in the backyard. It's okay, I'll give you some money to buy legal weed instead of buying one off the streets. Of course, it's coming from good heart. So they try to protect the kids from the worst consequences of the substance use. But then as a result, they come across as if they enabling the same kind of behavior that they're trying to protect their kids from. Of course, the parents get upset with their kids. They yell at them. They try to make them feel the pain that the parents themselves experience. And as a result, what happens? The kids are afraid of going back home. They're afraid of getting yelled at. So they go out and they spend more time with their friends using drugs. So see how complicated it gets when we're talking about the family, not just the groupies. So what can we do to stop this cycle of addiction? There are a few things. One is, I think this is the most important one, to try to be realistic, to fight our own stigma, our own denial, and our own wishful thinking. So first, we have to establish healthy boundaries. We have to protect ourselves. So if you're a parent of somebody who's using drugs, or you live with somebody who needs help, so first of all, you have to make sure that you take care of yourself, that you are strong enough to help another person. So everybody heard about Alcoholics Anonymous, AA. So the AA has another branch that's called Al-Anon that established to help family members who are helping somebody with alcohol addiction. There is also another group that's called NA, Narcotics Anonymous. So that is obviously similar branch, similar ideology, but designed to help people with narcotic addiction. So second, you have to see what your realistic options are. Sometimes when a person's drug addiction becomes overwhelming problem that engulfs the whole household, so it may be the healthiest option to ask them to leave. So see, the thing is that drug addiction is an illness. And at that point, when it develops, it has to be addressed as an illness. However, as with most of the illnesses in the medical field, you can't fix anything without the patients participating. So the patient has to tell us that they want to get better. And then the door opens with variety of opportunities how they can do that. There is inpatient or outpatient rehabs. There are sometimes medications that can treat addiction directly. There are medications that can help with anxiety and depression, etc. Main treatment, of course, is psychotherapy, finding triggers, and deal with the negative emotions that are associated with the substance use. But the first step for the person is to recognize that they hit the rock bottom. Happened to Matthew a few times. So, and that what triggered his admission to rehab and his attempt to get better. Another important point in recovery is accepting the reality of relapse. Once a person is addicted to certain substances, they will always be addicted to the substance. They only can go into sustained remission. If they clean for over a year, we call it sustained remission. We never call it full recovery. Because once they start using the drugs again, even occasionally, even socially, they go downhill very quickly. So accepting the reality, support, and understanding, that is very important. The reasons why Matthew said that he relapsed so many times was because of the social support, enabling behavior, and people around him who didn't quite care, from his point of view, didn't quite care about him and his addiction, but just wanted to get something from him. So if you want to help somebody be there for them, for better or worse, to support them even when they're at the rock bottom. That's the hardest thing to do for everyone, and that's where it is the most important. Keep in mind that there is also professional help. There are psychiatrists who can help with emotional issues, who can guide you. There's substance use counselors who would use so-called harm reduction approach to help people to trust. It is important when you help your children or adolescents to ensure them that you're going to give them space and you're not going to pry around to get information from the counselors. That help the kids to open up and talk to the counselors themselves, to tell them the truth, and as a result to get the best support. In today's video we covered a lot of ground. We spoke about biological predisposition, that is temperament and family history. We spoke about emotional predisposition, that is anxiety, depression, failure in developmental stages, and we spoke about social support both at school, work, and family. We spoke about principles of recovery, very briefly touched upon medication and counseling for substance use. So please stay tuned in. More videos on addictions to come. The addictions are tightly related to the rest of the mental health problems. So please, if you're interested, stay tuned on these videos. I'll do my best to cover as much as I can. I'm going to finish with another quote from Matthew. I finally got sober for good in 2022. That was last year. That was the same year when he actually launched the book. So it was the hardest thing I ever did, but also the best thing I ever did. I realized that the drugs were not my friends, they were my enemies. They were killing me slowly. Let's remember Matthew with good words. No matter what happens, we don't know anything about his death. It only said in the news that he drowned. I'm sure that drugs were involved. I hope he didn't do it on purpose. Maybe it was a medical condition. His body was quite worn down with years of substance use. It is possible that he maybe had a heart attack or something else that caused him to pass out and drown. It is a big loss. He seemed to be a good person. After launching his book, he could have advocated for mental health, for substance use. All we can do now is just to pick up the baton from him and continue to fight stigma and support mental health. Stay tuned. Thank you very much for watching this video. Subscribe, click on other videos. We'll have so much to talk about. Thank you very much. Bye.